I'm Nikki Graham, Chair of Del Seton President's Council. Thank you so much for joining us for the 2021 Future of Care event in support of Del Seton Medical Center at the University of Texas at Austin. Things look a little different this year. For example, I'm sitting outside our beautiful Del Seton Medical Center as opposed to sitting with you in a ballroom. In a year that has tested so many of us, the nurses, doctors, and all frontline staff at Del Seton have demonstrated tremendous resiliency and never wavered in their commitment to caring for our community. We hope you will enjoy today's program and be inspired to support Del Seton Medical Center.
As you will hear throughout today's program and panel discussion, access to a world-class academic medical center has truly been life-saving for Central Texas. I'm Malini Rajput, Chair of the Del Seton 50. Along with Nikki, I want to say thank you for being with us virtually today. I am honored to introduce Sister Joanne Varsha, Vice Chair of Ascension Texas Board of Directors, to provide us with a moment of reflection.
I am honored to join you today for this annual Del Seton Future of Care event. My name is Sister Joanne Varsha, and I currently serve as the Vice Chair of the Ascension Texas Board of Trustees. I was privileged to live and work among you in Austin some years ago, and I still claim Central Texas as a very special place among the many locations I've ministered as a daughter of charity. We have so much to be grateful for as we gather for this event. And by your virtual presence today, you are literally advancing the future of care. Although this event is future-oriented, we would be remiss if we did not spend a few moments reflecting together on where we've come from in our storied past. The Daughters of Charity, at the request of a group of extraordinarily forward-thinking and creative civic leaders, such as yourselves, arrived in Central Texas in the early 1900s. Healthcare, of course, was quite basic in those days, but even then, the community knew that providing the very best, indeed the most advanced care for all people was critical. It's what we did then, it's what we do now on a much more sophisticated level. In an eerie sort of deja vu event, the community was struck with the influenza pandemic in 1918. It was destined to take 40 million lives worldwide. Masks, school and restaurant closings, football games with no cheering fans, more masks, hand washing, you know the drill. Fast forward to 2021, and Del Seton Medical Center at the University of Texas is again front and center in the battle to keep our communities healthy in the midst of a worldwide pandemic. Allow me to once again give a shout out to our incredibly talented and professional healthcare heroes who stand solidly on the shoulders of those who fought against the influenza epidemic in 1918. I can just imagine those community leaders, the Daughters of Charity, and the healthcare professionals they collaborated with back then, silently cheering on our providers and essential workers today. The victims of the Spanish flu would not have received the care they needed without community involvement. That same dynamic is true today. Your presence with us is a sign of the generosity that is essential to the process of providing world-class healthcare available to all Central Texans. Our friend Senator Kirk Watson, whom we honor today, has long been an advocate and staunch supporter of this effort. However, I would suggest to you that there were many people throughout our history who were perhaps not as well known as someone like Kirk, who each did their part to make a great difference. You are one of those individuals making this difference today. Each one of you literally advances the future of care for this community. Partnerships continue to be the secret sauce here in Central Texas. And you'll pardon my rather dated expression from the song, "Deep in the Heart of Texas, because I see you today as the heart of Texas. It is your loving and charitable actions today that someone 100 years from now will recognize. May this time of virtual presence bring encouragement and hope to each of us as we continue the challenging journey of providing not only the very best technical expertise to the healing process, but also the finest spiritual and holistic care to this region. May God bless our efforts and sustain us into a bright future. And thank you for being a huge part of this exciting adventure. I'd like to close with the wise saying of St. Vincent de Paul, the 17th century peasant priest who founded the Daughters of Charity. He was a master of using collaboration as a vehicle for service to the community. He writes, "We must redouble our efforts and our ordinary duties on certain occasions when the service of God requires it. Then God will not fail to increase also our strength and our courage. Amen."
Having a good healthcare system in place within a city promotes stability within the city itself. Not having to go far and leave your family or leave your responsibilities of your everyday life just to get something taken care of medically is important.
So Austin is a very innovative community. I think that we are trying to do something radically different from what most other academic medical centers in the country have done, and Austin is the perfect place to do that.
Ascension's vision for Del Seaton Medical Center at the University of Texas is to be a world-class healthcare provider that people from around the world recognize as a place to obtain the highest quality of care that they can achieve.
Very few academic medical centers are less than 3 years old, which our hospital is. The physical infrastructure brought really a whole new energy, a new medical school, a new building, many new educational programs from medical students to residency programs to fellowships. And then again, that creates this unique environment that allows us to offer care and services that were not previously available in this community.
I think that excellence in healthcare means a compilation of multiple things. So having the availability of different technologies and staying on top of the cutting edge of research.
When I think of excellence in healthcare, I think of a couple of things really. One is, of course, that it's outstanding healthcare. It is on the cutting edge. It is healthcare that we can get right here at home, that we could get at the major medical institutions and at world-class healthcare hospitals across the country. But I also think of it from a community standpoint. I'm blessed that I had excellent healthcare. It was early, it was effective, and it was frequent. That kept me alive at a time when I had a disease that was supposed to kill me. And when I think of excellence in healthcare, I think of excellence where everyone has that ability. They have that sort of access to early, effective, and frequent healthcare. And part of what we are doing in this community is by making sure we have a modern 21st century teaching and safety net hospital is we're doing better. But we need to pursue excellence so we'll do even better when it comes to providing healthcare for everyone.
The staff here really, truly want to give the highest quality of care. I'm so proud to work with the other nurses that I work with, other techs that I work with, the doctors, the residents, everybody. I truly think that their heart is in it. It's a really, really hard job to be in, but I truly think that the people make the hospital, and I think that translates into excellent care, because when people's hearts are in it, they care.
Philanthropy is an additional need in order to continue to support our mission of taking care of not just the poor, but also the vulnerable as well.
There's no question that our partnership with philanthropists is critical to our mission. The types of programs that we're introducing are types of programs that are generally not financially sustainable on their own, and without that critical startup capital, many of these programs would not exist.
I believe that all of our patients, regardless of their walks of life, deserve the best care. When you invest in people who want to do the best and you give them the tools to do the best, they will do their best.
The most important part of the healthcare team is the patient, and all of us come together around improving the health of that person. And so investing in the professional development, the skills, and the expertise of the healthcare team pays dividends in terms of our ability to deliver outstanding care to our patients.
Thank you, Nikki and Malini, and thank you, Sister Joanne, for that beautiful reflection. Hello, I am Bill Cote, Executive Director of Development at the Del Seaton Medical Center at the University of Texas. I took on my current role with Del Seaton in the middle of the pandemic, and while I knew from being with the Seaton Foundations already that the Austin community is incredibly generous, seeing the outpouring of support firsthand has really been something special. I look forward to continuing our work with our donors, supporters, and community leaders, and new friends as well, to help carry the mission of Ascension Seaton into the future. As we all know, COVID-19 has impacted much more than our healthcare system. From public policy and social issues to the economic and business impact, COVID-19 has truly spared no one, and many questions remain in the minds of Central Texans. Today's panel discussion will address many of these questions. Our esteemed panel features Dr. Beth Schulwolf, Chief Medical Officer of Del Seaton Medical Center, Gary Farmer, President of Heritage Title Company of Austin, and Kirk Watson, Founding Dean of the Hobby School of Public Affairs at the University of Houston. And of course, Dean Watson is also a former mayor of Austin and state senator, whose leadership was vital in the creation of this amazing academic medical center. And now, I am very pleased to introduce today's moderator for our discussion, Heather Ladage. Heather is the market president and publisher of the Austin Business Journal and a member of Del Seaton's President's Council. We hope you will enjoy today's discussion. Take it away, Heather.
Thank you, Bill. I'm thrilled to have this group of esteemed panelists with us today representing the public, private, and healthcare sector. And, you know, here we are more than a year later than the pandemic started, after the pandemic started. And I think maybe the best way to set the stage is to go to you, Dr. Schulwolf. Can you just briefly walk us through from mid-March of last year to now and what you've experienced at Del Seaton caring for COVID-19 patients?
I think for Del Seaton in particular, our team these last months just really showed how much of a team we are, how much unity there is, and how much we were able to even form stronger bonds across all disciplines. I would say that Del Seaton, you know, we identify as a hospital that really cares for the community and especially those that are more vulnerable. And I think we really were able to do that during this pandemic. Really were able to align with all the clinicians and the bedside providers to bring care to the population, but also to be able to partner with our community partners even closer to help to provide care when the patient's ready to leave the hospital. I would say that it's been quite a journey for all of us, both from the pride that we take of the care that we provided for our patients, but also in reflecting back on the how intense of a time it was with the changes that happened almost daily to when we were surging in the summer and then again this past winter. That really it's nice now to take a step back, to take some breaths and to reflect back on the intensity of the time as well as all of the care we were able to provide. Both acknowledging the pride that we take, but also the fatigue and the just the mental toll that it's taken on everybody. But I think looking back on all that we've been able to provide and accomplish, it's quite a story to tell around our team here at Del Seaton.
Dean Watson, When you rallied around our 10 goals and 10 years vision, would you have ever imagined the new hospital would be at the center of managing a global pandemic?
Well, I've said it more than once that I can't imagine what it would have been like going through this awful year, this awful pandemic, without Dell Seton Medical Center and without the medical school. You ask about how did I foresee that? Of course, I didn't foresee and never, frankly, I'm not sure I ever could have imagined what we've gone through in the past year with regard to the pandemic. But what I hoped for, and I think a lot of what the community hoped for, a lot of people in the community were hoping for, was that we would, as part of those 10 goals in 10 years, be in a situation where we would be far better off in terms of managing our health and medical care if we had those 10 goals in 10 years. And of course, we've suggested or referenced at least two of them. One was a medical school at the University of Texas, and the other was a modern 21st century teaching and safety net hospital, which we have with Dell Seton. And the whole aspect of that was that it would provide better health care than we had or would have in the future. It would attract and retain the quality physicians and nurses and other affiliated healthcare personnel so that we would be better off. And as you point out, it reacted just that way. As the doctor said, as we look at what has happened over the past year, thank goodness we had these jewels, if you will, of the medical school and the modern 21st century teaching hospital. Because as I started, I'm not sure how we would have dealt with it without them.
Mr. Farmer, so you're a key leader in the business community. Can you tell us about how the business community, kind of initial concerns and, how we seen businesses kind of react to those?
Well, Heather, clearly business in Austin has been impacted. Austin, like every other community in our country, has been impacted. Unfortunately, we've seen a number of businesses close, both large and small. Hopefully, many of them at this time have reopened. Hopefully, many others will be able to reopen. Unfortunately, some of them will not recover and be able to reopen. Many businesses have scaled back. The pandemic has not allowed any number of these businesses to operate their business in the manner at which they had been operating, at the manner at which they were accustomed. And so they had to cut back based on what was going on at that particular moment in time. In our Austin MSA, which includes Travis, Williamson, Hayes, Caldwell, and Bastrop County, in those 5 counties in March and April of 2020, we lost 128,600 jobs. That's a lot of families impacted by job loss. Now, the good news is that as of December the 31st of 2020, we had regained all but 11,000 of those jobs. That makes Austin one of the most resilient communities in the country. In fact, it places us in the top 3 in terms of job recovery. And that, I think, as much as, if not more than anything else, impacts the health of our entire community. So clearly we were impacted. Clearly we're working to recover each and all of those jobs and all of the various sectors that have been harmed by this very terrible situation. But we still have work to do, and we're working on it.
So I'd like to talk to each of you kind of about how the pandemic has changed your sectors. So do you think that ultimately we'll be stronger in the long run? And I'm going to start with you, Dr. Schulwolf, in the healthcare sector. So how has the pandemic affected how patients are receiving care? So, for instance, we've seen an uptick in the amount of use of telemedicine, but we also know patients are seeking care. We also know how patients are necessarily seeking care when they need it. I'd just be curious how you think it will change in the long run. Are we now more comfortable with telemedicine and managing our care a bit?
Yeah, I think telemedicine is going to be one of the longstanding changes that come out of the pandemic. It has been something in development for many years, and the pandemic really pushed it along at a much faster rate that many of us were happy to see. I think from an access perspective, from a patient satisfaction and experience perspective, we're able to better provide them care. And certainly not all encounters are good for telemedicine, but it allows for the ability to be flexible and to be able to meet the patient where they are for their care, and even to, especially for specialty care, for maybe patients that don't live close, would be able to bring them closer to our specialists that we offer here. So I think that's going to be one of the longstanding changes in healthcare is telemedicine.
So kind of segue over between Dean Watson, you have the education side and the public policy side in your career. As we've witnessed, the pandemic has highlighted some systemic social issues. Can you talk a little bit about the policies that you think we're going to need to address moving forward?
Well, the way I'd start that is talk about the way I hope or wish we would go forward as we talk about what those policies are. As you point out, COVID has exposed some things to us. What I really hope we do is we take advantage, if you will, of this COVID moment. And we look at what happened and we say, okay, let's put politics aside. Let's just start with what we know occurred and look at how do we come out of this on the other side better. Gary used the term resilient earlier. How do we come out of this more resilient so that if something were to happen like this, we would be in a better position? And here's kind of the way I look at that. I think prior to COVID, in a lot of ways, and I'll talk about a couple of them, we had sort of this false sense that we could get by without paying attention to certain things. For example, you mentioned the societal disparities. COVID has laid bare that there are great disparities in our healthcare in this country and in this state and in our community. So let's not just hope that everybody gets vaccinated and we come out of it and we just go back to the way it was. Let us look at what we need to do to avoid those disparities and what is underlying that. What were the reasons that it exposed those disparities in such a real way? In addition, there are other policies that, again, we need to set aside the politics and ask the hard questions about it. But, things like time off, paid sick leave. Right after COVID hit, we knew that we needed to allow, if you remember at the beginning of that, we needed to allow some sort of sick leave so that people could take care of folks. The other thing that came up was we've debated for a long time how best to provide coverage for healthcare. Well, when it is employer-based coverage and all of a sudden people are losing their jobs because those jobs are going away because of closing down situations, we need to look at things of that nature. It even goes down as basic as we have people that we label essential workers, but we're not providing them with some of the basics. They're essential to our way of life, but yet we're not providing them some of the basics. So I think that there's going to be a number of things that we ought to take the COVID moment. The legislative session has started at in terms of all this. It's not really going to happen, I don't think, in this legislative session, but during this interim and otherwise really study it. And then I'll say there's two big areas. I think it's going to take we're going to need to take a real hard look at Medicaid and why it is that we are one of the few states that doesn't expand Medicaid when we've seen how much better it might provide us health care coverage in our state. And I think we need to look even more at mental health or brain health because of the role that COVID has had in exposing our needs in that regard as well.
So Gary, we've been reporting there's 43 towers being built downtown Austin right now.
God
and
bless.
There are a lot of folks saying, who's going to move into these towers with this new remote working?
So Heather, let me answer the question this way. In 2008 and 2009, the global financial crisis, Austin, Texas was the LIFO model in the country. Out of the 100 largest MSAs in the country, Austin was the #1 market for recovery. We were the last of the 100 to have positive job growth. We went negative in June of 2008. We were down for 12 months. We lost about 18,000 jobs. We started growing jobs again, the first one to start growing jobs, the first one to reattain or reacquire our pre-recession employment level. And if you look from 2009 forward, we're the most prolific creator of jobs on a percentage basis in America. And we did that having really one economic development sector, tech. And God bless tech. I'm glad we had them then, and I'm glad we have them now. I believe that Austin, Texas will lead this country out of the pandemic recession. And I believe that for the following reasons. We do still have tech, but tech today is bigger, better, deeper, stronger than it was in 2008, 2009. But in addition to that, today we have a life sciences sector. But for Dell Medical at the University of Texas, but for the new teaching hospital, we likely wouldn't. But now we do have a life sciences sector. And oftentimes, it's the second or third most prolific source of relocation opportunities. Thirdly, and those who have lived in Austin for a long time and understand it well may find this hard to believe, but we have a national defense sector. When we recruited the Army Futures Command, we recruited the national defense sector. General Murray has said because of our mission, he believes that every national defense contractor will need to be in proximity to the Army Futures Command based on what they do and how they interact with private industry. So there's 3 sectors. And then, thankfully, in the summer of 2020, we were able to attract Tesla. We didn't just attract a company, we attracted an industry. We now have an automotive sector, automotive manufacturing sector right here in Austin, Texas, which is fantastic because Tesla would tell you that 65% of the 5,000 jobs to be created will be available to working class families. You're not going to have a college degree or some advanced degree to get a job at Tesla. Tesla is going to be very good for the middle income job classification. That's good for all of our folks. So today we have 4 economic development sectors that we can rely on. Diversification means sustainability, really. And so I believe that Austin will lead this country out of this globally induced pandemic, and we're going to do well. Who they're going to be, I can't really tell you by name. But then again, I suggest you're going to see a lot of names that you do know and do recognize. A lot of different articles around the country touting Austin as the leading city coming out of the pandemic.
Thanks, Gary. I wish we had all the time in the world today, but I'm going to kind of wrap it up by asking our panelists one last question today. And I really want to hear from each of you how you personally feel moving into the future, what the rest of 2021 looks like, and the one thing that you would ask everyone with us to do to make sure that we come out stronger and more resilient. There's good news out there. More than 25% of Travis County residents over 16 have had their first dose of vaccine. We're at stage 3, but what do you all want us to do?
I would say in the very immediate time period to truly continue wearing your masks, to continue social distancing where it's appropriate as they slowly expand things, to take that opportunity to be able to be with your friends and loved ones, but still to remember that to keep your community safe by continuing to wear your mask, and then to to also get your vaccine when you're able to do that. And I also do support in general on a much broader scale, any type of healthcare system redesign for access to care for our patients, and particularly the most vulnerable that were highlighted earlier. I would very, very much appreciate that.
I'll follow up on that by saying that one of my rules of public policy, one of my rules of leadership or bringing about change has always been have a short-term focus, but with a long-term vision. And as a cancer survivor, one of the gifts of cancer was that it taught me to focus on what's in front of me right now, with the hope that if I get a good long life or career or whatever out of it, that I can carry out a long-term vision. And what you just heard the doctor say, I think, is appropriate. We're still not out of all of this. So we need to have a short-term focus. Let's keep a relatively short-term focus. Let's keep focused on what we need to do so that the long-term vision that you've heard people talk about and that we can be so optimistic about. That's the other thing, is as you listen to this, our community is so well positioned to come out with a long-term vision that is positive and happy. So let's hang on to that. Let's stay focused so that long-term vision is what we want it to be.
So Heather, as I heard you ask the question, you said, what can we do to affect positive outcome? The we are not the three of us on this panel. The we is everybody that can hear our voices. I would suggest that what we can do is communicate with our elected officials. Public policy matters. Good public policy matters a lot, and so does bad public policy. It matters a lot. In this day and age, it is so easy to communicate with your elected officials. The silent majority should be silent no longer. An email, a voicemail, any type of communicative opportunity should be taken to express your opinion on public policy, whether you agree or disagree. The vast majority of the public needs to be involved. We can no longer afford vocal minorities to drive public policy, whether on the right or the left. I'm not advocating for a particular political view. I'm advocating for involvement of everyone in this community. We are so largely blessed to live in a place like Austin, Texas. It will be better if we all participate and do our own special part.
I don't think I can say it any better than that. I want to thank you all today for joining us. I really appreciate your time, and thank you, Dean Watson, Gary Farmer, and Dr. Beth Schulwolf.
What a great conversation from our panel. I really appreciate each of their perspectives. Thank you very much. Hello, I'm Tim Briarty, president of Del Seaton Medical Center at the University of Texas. I've seen firsthand the toll the pandemic has taken on our frontline caregivers and associates. But I've also seen how the support from the community has brightened their days and lifted them up right when they needed it most. From COVID-19 to the recent historic winter storm which affected our community. Both COVID-19 and the winter storm have truly highlighted healthcare doesn't stop being provided. Regardless of what's going on in the world, the need for healthcare will always remain. At Del Seaton, we have not only served our community with world-class medical care, we have been on the front line of clinical trials, technological advancements, and innovation. None of this would be happening without the vision of Dean Kirk Watson. In 2012, while serving the Austin area in the Texas Senate, he laid out a vision of 10 goals in 10 years, aimed at positively impacting the health and economy of Central Texas. As a result of this vision, a new modern teaching hospital, Del Medical School, and a new safety net hospital, Del Seaton, were built right here in the middle of Austin. Our medical district represents the first and only place in the country where a nonprofit health system with a level 1 trauma center, a tier 1 research university, and a county health district have joined forces to reimagine the way healthcare is delivered. Through our unique partnership with Del Medical School, we are able to better serve our patients as a regional and national center of excellence, regardless of their ability to pay. In 2020, 68% of the patients cared for at Del Seton were un- or underinsured. We believe the number of un- and underinsured patients cared for will likely grow in the coming year due to the economic effects of the pandemic. Providing all of our patients with holistic, spiritually centered care will always remain at the heart of who we are, and we will not settle until we provide for a patient's every health need here in Austin. As we continue to grow alongside our growing community and provide world-class care to all, we have set our sights on establishing an abdominal transplant program, growing our already exceptional neurosciences program, encouraging our associates, residents, and fellows to engage in and lead research, technology, and innovation projects. And one of our most important efforts for the future of healthcare in Central Texas, recruiting and retaining the best and brightest medical talent. Having the world's best healthcare leaders in Central Texas doesn't just benefit patients of Del Seton or patients of our broader Ascension Seton network. Exceptional clinical staff bring new ideas and approaches to a community which address the root causes of disease. They lead clinical trials and train the next generation of doctors and nurses. Growing our incredible clinical teams will serve to improve healthcare for not just Central Texans, but all Texans. I am honored to announce we have established the Senator Kirk Watson Excellence in Healthcare Fund, which, with your support, will accelerate our investment into recruiting and retaining top medical talent. The fund will serve as the catalyst for the next phase of growth in our medical community and is aptly named for the man who quite literally changed healthcare in Central Texas. Thank you, Senator Watson.
I'm more touched than you can really know by the creation of the Senator Kirk Watson Fund for Healthcare Excellence. It means a great deal to me. Seton is a remarkable asset in Central Texas, and it has been for a long time. I could regale you with all of the ways that Seton has impacted my family's life on a personal level when it comes to health and helping us through some unhealthy times. I'd love to tell you stories about the sisters and how much they meant to me over the years. I still talk about the way Sister Gertrude checked on my parents when they spent so many days and nights in the hospital. And I can still see Sister Gert standing by herself in front of my parents' church in Wimberley, looking right at me as we drove off to the cemetery after my mother's funeral. A little guardian angel on earth. By the way, those sisters meant so much to me that when they were leaving Austin, I hosted them and Bishop McCarthy at a Capitol lunch just to say thank you. Angels, all of them. The spirit of those guardians, people who attend to us, keep us, safeguard us, lift us up, promise us a better future, is the spirit of this fund. 10 years ago this September, I laid out a vision for our community achieving 10 goals in 10 years to transform our healthcare as well as our economy in Austin and Central Texas, to assure excellence in the future of healthcare. I'm very proud that the community embraced that vision and that every item has been achieved, even as we will need to continue to nurture it and continue to add to them because of their ongoing nature and growing needs. Achieving these 10 goals in 10 years, in my view, was the best example of community collaboration I've ever seen. The 10 in 10 was born of 1,000 mothers. Remember them. 1, build a medical school at the University of Texas at Austin. 2, build a modern 21st century teaching and safety net hospital. 3, establish modern, uniquely Austin health clinics in our neighborhoods. 4, develop laboratories and other facilities for public and private research. 5, launch a new commercialization incubator. 6, make Austin a center for comprehensive cancer care. 7, provide needed psychiatric care and facilities. 8, improve basic infrastructure and create a sense of place. 9, bolster the medical examiner's office. And 10, solve the funding puzzle. A key part of the community embracing this vision was item number 10, solving the funding puzzle. How to finance all of these big goals. As everyone knows, the community stepped up by voting a tax increase on itself, to create, among other things, a community investment in what is now known as the Dell Medical School. But that wouldn't have solved the whole funding puzzle alone. A key piece was Ascension, who, through Seton, had been helping solve the community's more general healthcare funding puzzle for decades, and certainly since 1995, when it took financial and managerial responsibility for Brackenridge Hospital. Seton had been the leader in funding the graduate medical education in our community through the residency program. And of course, Seton cared for our babies and our children at Dell Children's Medical Center. Seton attended to us, kept us, safeguarded us, lifted us up, promised us a better future. As part of solving the funding puzzle of the 10 goals in 10 years, Ascension Seton lifted the community up again by answering how we would build a modern 21st century teaching hospital, number 2 on that list. And this hospital was to not only serve as a healthcare guardian for us, but to lift us up and assure we're on the edge of medical breakthroughs, assure the future of care. And they did it at no taxpayer expense. Ascension and its generous donors, people like you, gave us this tremendous asset. And I'll say it, gave it to us in the spirit of guardian angels. As we've needed them, we've found more angels. That's where this new fund for healthcare excellence comes in. It's here to assure Ascension Seton and each and all of you can continue in that spirit of taking care of us and doing so in a way that means we will continue to improve our healthcare, enhance it, be on the forefront. So I end by asking you to continue supporting the future of care. Continue lifting us up and safeguarding where we're going. Help us to realize the potential of the 10 goals in 10 years, the new modern teaching hospital, the doctors, nurses, and healthcare providers it will attract and retain for the future of care. Please be one of the many angels we are so blessed to have among us. Thank you for this wonderful honor. I'm so proud this fund bears my name. And thank you for allowing me to have served this generous and wonderful community. God bless you. Please be safe, happy, and healthy.
Thank you, Kirk. I'm truly honored to join you in supporting Dell Seton Medical Center. I hope you all will join us as well by making a donation to the Senator Kirk Watson Excellence in Healthcare Fund. As we heard throughout the program today, the growth of the Austin area has not been slowed by the pandemic. And when our community needed exceptional and compassionate healthcare most, the caregivers at Dell Seton were there to provide it.
Philanthropy has long been the change maker in healthcare, and I'm excited to announce that Dell Seton has received a generous matching donation from Lucy Johnson and UFCU to support the Senator Kirk Watson Excellence in Healthcare Fund. Over the next couple of weeks, we would like you to join us in support of Dell Seton Medical Center. Every donation received in the next 2 weeks will go twice as far thanks to Lucy and UFCU's generosity. Together, we can change the future of healthcare. Thank you for joining us today.
My name is Kelly Gray, and I'm the CEO of Service Lloyd's Insurance Company, a family-owned business serving the Austin community for 40 years. This year has brought about many changes and challenges, but one constant is Del Seaton's continued commitment to providing exceptional, compassionate care for our community. On behalf of my colleagues and family, I'd like to thank you for supporting Del Seaton Medical Center at the University of Texas. Quite literally changed the future of care.